Today I am going to present to you a patient who has undergone a PRS treatment to both her knees 1.5 months back. Her experiences will be reassuring to people who are considering this procedure for pain in both knees due to osteoarthritis. So I'm going to welcome her and then let her speak for herself. Welcome. How are you? What's your name? Kindly introduce yourself.
Yeah, my name is Akila. So I'm fine, I'm doing good. So happy to be here. I was generally suffering from this knee pain for a long time. When I fell down and I got hurt, then the pain got more, it is aggravative, and then only I found out it's related to the arthritis. And then thankful to God that we found the doctor. I have to thank my husband. He only found the doctor actually. Really, I was totally confused. I couldn't concentrate on my work. What is going to happen the next 10 years? Will I able to walk or not? Because often daily being in pain is really a bad thing in life. Nobody should have that. So I don't know. God has shown a way. When I came to meet the doctor, I wasn't in a hope, but something was telling me that it should get cured. I should get cured because I have a lot of responsibilities, lot of things to do. But when the day I came and met him, I got 200% hope that I will get cured. With my effort as well as the doctor, the way he responded, the way he explained everything, and individually the dedication, how he came, even for the x-ray he came and he explained everything. He helped me to, I never seen a doctor coming in x-ray and helping like that. So I was 200% confident, and while going itself I decided I have to do this treatment. And I'm so confident I'll get cured. And then we decided, and we have undergone the procedure, and I'm fine now. Now I'm not having a pain in my knee at all. The few things left is I have to strengthen myself, strengthen my muscles. Those kind of things are left out. But the pain which was there continuously in my knee is not there. I'm 100% relieved, and in my mind as well as in pain, I'm very happy here to tell this.
What are the issues? Today we saw you and there is little lack of flexibility. Although technically speaking, you are able to bend your knees fully. You want to get rid of any possible stiffness which you feel. But although on looking at you, there is no restriction of mobility. So you have to get that, and I've taught you those exercises which you can work on. So the measures which I usually tell any patient before coming to a doctor is to strengthen the muscles and get the flexibility. So now, having undergone that, it is easy to tell a patient before, but it is difficult for a patient to do it because their joints are stiff. But they have to do it if they want to get better. And now you want to get better. You are a very strong person. You are before itself. You said I have conditioned my body. I brought my weight down, and now this is the last thing which I want to do. And you've done that. You've undergone this treatment. Now I'm quite confident that you will be able to work on the flexibility, which is pretty good. You don't have any other issues like back or hip issues. You've seen that you have straight leg raising is full, no tight hamstrings, no back pain, nothing. And knee, we saw there is no collection of fluid. It's nice. There are no sore spots in the knee, anywhere in the knee, except the perceived or felt lack of flexibility on your part. So I've shown you the way forward, and hopefully over the next 1 month or two, you will get this flexibility back. Anything else you want to ask me?
No, I'm totally happy about I'm getting cured. I'll follow the remaining instructions which you have given me. And maybe the next visit will be a full cured visit.
Yeah, we hope to hear from you and keep us posted. And I'm looking forward to your next visit. You asked for a repeat MRI scan today to see if the cartilage is growing back. Well, this is the desire of every person. We have to wait. MRI scans, 3 Tesla MRI scan is the one which I And last time also you got it. Normal MRI scans will not show anything. 3 Tesla MRI scans done after 6 months will show evidence of cartilage growing back. So when you come back after 6 months, we'll get it done, and hopefully there should be some regeneration of cartilage. But we don't bank upon the regeneration of cartilage. We help on long-term pain relief, because and this treatment, biological treatment given into the knee, addresses the problem straight away without sidestepping or bypassing or anything. You might have seen a road. When the road is congested, they build a bypass road, because cities in Chennai city is all congested. They build a bypass, but they are not doing anything to tackle the congestion in the road. So this procedure doesn't bypass, it goes straight away, attacks the problem head on straight away. So it should work, and even if it may work in other conditions like rheumatoid arthritis also. So we have attacked the problem right at the root, and it should work. Recovery takes its own time. It's not a magic cure. So hopefully the MRI scans will show some regeneration, but most importantly, your pain, which has now gone, this pain relief will be there for quite some time. Now at 1.5 months you have got, but the 2 years to 10 years, what I tell my patients. And if need be, it can be repeated, the whole procedure, or just booster doses of PRP, which is just an office procedure. Thank you very much for coming, and I wish you all the best. I will see you after 2 months, in the end of February.
Sure, thank you.
Bye. Have a nice day.
Thank you.
Namaste.